And you want
just,
me just to use an old, like a GPRA that I've already done?
yeah, but just make up a name, and then change any random details or answers.
That's client list. And we're going to add a new client because they've not been here before.
Mm-hmm.
We'll put Jessica Test. She is a female. Her date of birth. And then the last 4 of her social. If you can add the entire social, that's the best. She is not Hispanic, Latino. She identifies herself as Caucasian, and you'll click the next button for this double arrow button will take you to the next page. It's asking for alternative names. She does not have any alternative names. She doesn't have any special needs, etc.
And so, Amanda, on those screens, you're clicking the double arrow button to just skip to the next one, right?
Yes.
What would happen if someone accidentally hit like save or finish there?
So it will not allow you to continue on to the next page or allow you to admit the GPRA overall. You'll have to kind of click through this double arrow to get to the final end so that they can be accepted into iSmart, if that's an appropriate way to put it.
Yeah. And none of those things are yellow, so that means they're not required.
Correct.
So you can
Yellow
just skip
is
through
absolutely
those.
required. So her phone number. Oops. And then you'll need to put in an address as well. That is a required field, although it's not yellow. These obviously are yellow.
Right.
And then it will double check with the post office if that's a correct address, and it does come up as an address valid. So then you can click on to the next screen again.
If you had tried or missed that and tried to click through, would it give you an error that tells you that you need to enter the address?
There's a little pop-up box that'll say, did you actually mean this address, or this is a suggested address. I've had that a few times, even with my own address for some reason. I don't know why that works, but this one was valid. And then you can collect collateral contacts on this page. I collect them through our EHR. So.
And some people just have them on paper in the client file.
Correct, yes, paper on the client file, it works as well. So then you can click double arrow through that again, because again, those aren't required. Any other information, there's no double arrows, so you can finish, suggesting that all the data have been collected. That'll bring you back to like the client search page. Up here in the left-hand corner, you'll see that she is selected. If for some reason you want to double check that she is still there, you can search by the last name, the first name, or the social, and then that will bring them down to the bottom where you can click on them using the little pencil arrow. We will need to put that into using this client group enrollment, add them to our contract. Is that not? It won't let me do that in test.
That might be one we didn't enter there. I wonder if that's going to be a problem. Can you do it under anything else?
There's nothing that's popping up. No matches found.
All right. Let's pause the record.
Great.
Okay, so we'll try this and see if it works.
Okay. So you'll click on the activity list and it'll prompt you to start an episode with this client. So you'll click start new episode over here in the right hand corner. What is the domain that we're using? With the SOR grant, we are going to be using grant management. So you'll click on that and click go. And then these are case information, demographics. Again, how was the first contact? I met with her for an appointment. She is out of Black Hawk County. The day we first met each other. Let's see, that was back in June. So you'll use the appropriate day. And then that intake day actually happened in June as well. So you'll just prompt whatever day you did the conversation with the GPRA. And then you'll click finish. Okay. If you click over here on GPRA GPRA, you can be GPRA intake. Oh, I need to enroll them in the program here, it looks like. I missed a step. So program enroll, add enrollment. The program name is the SOR grant. And then, like I said, we started her in June. And click finish. From there, we can do GPRA and the GPRA intake. So we interviewed her on her first intake date, which was June 26th. It'll pre-populate your enrollment that you've already put in for her being in the SOR grant. You'll double click the arrows to begin plugging in all of your information. Again, the yellows are required. So her diagnosis is F11.2. She was diagnosed with an opioid use disorder at that time. In the last 3 years, she diagnosed, yes. And then which medications has she been receiving for treatment? She is currently prescribed methadone, so we're going to click yes on methadone. She has received it for 30 days, and she has not received any of these other medications, so I'm going to click no on those.
And just as a review, the GPRA is always talking about the last 30 days, right? So the reason you chose 30, even though the date was in June, is because it's asking about the last 30 days. It's easy to miss that little part of the question, so I just want to emphasize it.
Was she? Okay, so this should not be. You're saying
What's
this
that?
should be 0? You're saying this should be 0?
No, that's correct.
Oh, okay.
I just want people to know, like other people to know, that it's important to put that in there, because some people will put like 90 or however long she's been on the medication.
Right.
But really, the GPRA just wants to know the last 30 days.
Yes, the GPRA really does just want to focus on the last 30 days for most of the questions as well. So this is asking about alcohol use disorder. She has not been diagnosed with any alcohol use disorder. If it was a yes, then you would fill in the below medications as well, again, for the last 30 days. This question was screened by our program for co-occurring mental health and substance abuse. That answer is yes. And did she screen positive? Yes. Double arrow to the next page. I'll flip through my paper here. Make sure. So planned, gotta get to the right page. Planned services. What is your program staff planning on doing with her at intake? So this young lady is going to participate in outpatient treatment. She's going to participate in methadone and some recovery support. Well, no, actually, she didn't say that. That was another girl I was thinking of. Okay, so these are the two programs that we're going to be interested in helping her with. Click next, double arrow to the next page. Show them what kind of treatment services are we providing her. We did an assessment with her. We did a screening with her. We're doing treatment and recovery planning. We're also doing some individual counseling with her. She did not want any group or marriage counseling from us, so those are going to stay no's.
And I'm just going to interrupt here again, just to clarify this part. These services are all the ones that are being funded by the SOR grant that we're logging in here. So, I mean, you can leave it there, and we'll just imagine for this client that those are all things being funded by SOR. But just for everyone's reminder, we want to enter the things that are SOR funded here because that's where the data is going to show whether the SOR services are being effective at helping people reach their goals.
There we go. Okay. So again, these are all going to pre-populate no, and you'll click yes for the services that are going to be provided. Double clicking to the next page. These are all no's for us. Male, female, transgender. I like to remind the clients too that they can refuse any of these questions. So asking the client if they are Hispanic or Latino, she said no. And then asking them their race, and she said white. Have you ever served in the armed forces, the reserve, the National Guard? What area did you serve? She said no. So then it'll clear all those out. If it's yes, then all those, as you saw earlier, yellow, should answer the appropriate question there. And or someone close to you in the Armed Forces, National Guard, and you can answer no. So she has a grandparent, so she said yes, only one member. And then although these aren't yellow, you will fill these questions in. So what's the relationship? What's the grandparent? So other. Were they deployed? No. Were they physically injured? No. Did they develop any combat stress symptoms? No. Were they died or killed? No. And then click add, and it'll pop up in this box underneath. And then continue to the next page.
And Amanda, I don't know if your microphone is like right by your mouth or anything, but it's breaking up a little bit.
Oh.
So
okay.
If you can adjust it a tiny bit, it might help. It's been okay. It's just every once in a while it breaks up a little.
I'm not sure where my microphone is, to be honest. So.
Okay. Well, then just keep going, and I'll let you know if it's a problem.
Awesome. So then these, again, as Monica pointed out, the last 30 days is what the GPRA really wanted us to gather. So asking them if there's been any alcohol use in the last 30 days. She said no. And then if you kind of click out of the box or click on the page still, it'll gray out the next two questions because they're asking about alcohol use, 5 drinks or more, 4 drinks or fewer. And then you would answer those appropriately with the client. C is asking about illegal drugs, and yes, that's all illegal drugs. 0. When I ask clients these questions, I still remind them about, you know, privacy and confidentiality, and that we want what's best for them, so to answer them honestly. And then D is if they've used drugs and alcohol on the same day. And obviously that is grade 0 because she's got 0 for alcohol and drug use. So you'll do the double arrow to go to the next page. And they'll ask for in the last 30 days, how many days have you used the following? So if you replied, you know, 1 more days to drug use, the next couple of pages are asking what specific drug you used and the route. So because she replied 0, they're all zeroed out. So you'll double arrow to the next page. Again, the different medications or prescription drugs that they could be using or abusing. Since these are 0, I'll pop down here to 3. In the last 30 days, have you used any IV drugs? And that's a yes, no, refused, or missing data answers. And no. If that was a yes, then it would pop the next question up as well. Have you used a syringe or needle, cooker, cotton that was used by somebody else? The next page is asking about your family or your living conditions. So where have you been living most of the time? Again, in the last 30 days. She has a house. If we're housed, what type of housing? She has her own, or no, she's living with somebody else. And then, how satisfied are you with the conditions of your living space? Very dissatisfied, dissatisfied, neither nor, satisfied, very satisfied. And if there was drug use, the following 3 questions would be counted as a required. Because she had 0, they're also grayed out. Because she's female, it's asking if she's pregnant. She is not. Does she have children? Yes. How many children does she have? She has the answer 1. Are any of the children living with someone else due to child protection order? The answer is no. And then for how many children have you lost your parental rights? 0. Then this page is asking about education. So are you currently enrolled at school or a job training program? She is not enrolled. What is the highest level of education, whether or not you received a degree? And it'll have all the variety up here of what level she completed. Asking if they're currently employed. Today, again, the most current information, she is disabled. These boxes down here are asking about income. So in the last 30 days, pre-tax, how much received in wages? 0. She does not receive any public assistance or retirement. She gets $700 a month in disability. And the rest of these are 0s. Asking them the question, do you have to meet your needs? Her answer was mostly. And then going to the next page. Page is crime, criminal justice. So in the last 30 days, have you been arrested? Her answer was no. How many nights? Again, this is gray. So then how many nights have you been in jail or prison? 0. In the last 30 days, how many times have you committed a crime? Her answer is 0. If someone admits to illegal drug use in the GPRA, earlier in the GPRA, and you put 0 here, it will prompt you and say, but they admitted to illegal use, so you need to put how many days that they used illegal drugs in this box. Because again, it's illegal and it is a crime. So the next question, are you awaiting charges, trial, or sentencing? Her answer was no. Are you on parole or probation? The answer is yes. This page is asking about mental and physical health. So how would you rate your overall health right now? Her response was good. Again, focusing on the last 30 days. Have you had any inpatient treatment in the last 30 days for a physical complaint? Her answer was no. Emotional health, mental health, no. Alcohol or substance abuse, no. This section is asking about outpatient treatment. So she has not gone to a doctor for a physical complaint, but she did see her mental health counselor, and she did see her substance abuse counselor once as well. And then emergency room visits. Her answers were all no. This page is about continuing with mental health, but some questions about sexual health. Some clients, again, like to don't want to talk about this, so reminding them that they have the right to refuse. They don't answer this question. How many days have you engaged in sexual activity? Her answer was no. And then if it was a yes, it would ask you about how many sexual contacts, how many of those were unprotected, and of those individuals, if they've been tested positive for HIV or under the influence of a substance. Number 4, have you been tested for HIV? Yes, no, or refused. And then this question is really important. Do you know the results? I don't need to know if you're positive or negative. I just need to know if you know if you're, positive or negative. She knows her results. The next couple are about how they feel about their quality of life or their health. So on a range of very poor to very good. Good. Neither nor. A little. Satisfied. And how satisfied are you with yourself? Neither nor. In the last 30 days, not due to use of drugs or alcohol, how many days have you experienced serious depression? It was 10. Serious anxiety or tension, 20. She denied any hallucinations in the last 30 days. She said every day she struggles with concentration. No trouble controlling violent behavior. 0 suicides and no new prescriptions for emotional problem. How much have you been bothered by these? She said not at all. And the next page is about violence and trauma. So reading it verbatim, have you experienced any violence or trauma? Yes or no. If it's yes, then it'll prompt the following A through D. If it's a no, it'll gray those out. Again, in the last 30 days, have you been hit, kicked, slapped, or otherwise physically hurt? Her response was never. And we'll double arrow over. It's asking about social connections. In the last 30 days, have you had self-help groups or recovery, such as Alcoholics Anonymous, Narcotics Anonymous? She has attended 4 meetings. In the last 30 days, have you attended a religious or affiliated recovery help group? No. Have you attended meetings of organizations that support recovery other than those described above? She said no. In the last 30 days, do you have interaction with family or friends? She said yes. You were having trouble. Usually they'll respond with family or friends right off the bat, but I can remind them of some of the options. How satisfied are you with your personal relationships? And she responded neither nor. It'll give you a review of all the questions and the answers you filled in, and once you click finish, you are done putting a GPRA into iSmart.
Fantastic. Thank you very much. So at this point, this is the intake completed. You can see up on the top bar of the, yeah, right there,
Yep.
you can see that the follow-up and discharge are both available there. It will not allow you to do those on